clapping for her. So it's my pleasure to introduce my friend and an expert in hoarding, Dr. Chia-Ying Chou, who we asked to come here and give this talk because it's such a, I think, an under-recognized problem in our field, and so it's really awesome to have an expert here to talk about it, to help us understand what to look for. Dr. Chou did her postdoc here at UCSF, is an expert in hoarding disorder and particularly compassion-focused therapy. So she developed and ran the only RCT that there is for CFT for hoarding disorder. So, thank you.
Thank you everyone for being here, and thank you for inviting me, Shane and Dominic. So it's really nice to be back here. I was here doing my postdoc since 2014 to 2017, and I was hired by Dr. Carol Matthews, who I believe some of us know here. So at that time, Dr. Carol Matthews was running a clinical trial on hoarding, and so I was one of the clinicians that helped out running all the groups. And so that was a very, very valuable experience, and that helped me develop my clinical expertise and research expertise in treating hoarding. I'm realizing this is very echoey. Can you still hear me if I stand here? Mm-hmm. Okay, great. All right, so I'm going to talk a little bit talk a lot about hoarding and how we can help. So I plan to first talk about what is hoarding and the prevalence, the impact, and one of the main things that I would like to share with you is the contributing factors that we know so far about hoarding. Because if we know what's underneath the problem, then we can more likely help. And then we'll talk about how we can help and some existing treatments that's available. And I won't spend too much time on introducing the treatments because that will take another workshop to do. But I will let you know what's available right now. So before we begin, I would like you to, if you don't mind, take a few minutes, and if you can close your eyes, I'm going to ask you a few questions about hoarding. So with your eyes closed, I'm going to ask you, when I say the word hoarding, what images, what words, what feelings, what thoughts come to your mind? And please take a mental picture of all the images, thoughts, and feelings that you have. Now I'm going to ask you another question. So I'm going to ask you, do you, at any point in your life, or any aspect of your life right now, ever had any difficulties letting go of something? And by something, I see some hands raised, good. By something, I don't necessarily mean material items. It can be relationships that you have a hard time letting go of. It can be responsibilities. It can be things on your to-do list. It can be activities on your calendar. Things that you have difficulties letting go of, or things that you work so hard to accumulate, such as fame, such as recognition, such as money for some. So, right, thank you very much, and you can open your eyes now. Thank you for indulging me. So, the reason why I would like us to go through that exercise is that that actually is how I become interested and become able to more empathize people with hoarding issues. Because a lot of times when we think about people hoarding material stuff, it feels like, well, that's a very strange thing. But if we check in with ourselves, we share a lot of similarities actually. And I myself have some difficulties letting go of responsibilities, At some point in my life, I have difficulties letting go of relationships. So I wanted to say that maybe more or less we understand why people hoard. And I hope that we can bring that kind of empathy in the next 15 minutes or so of our time together. So this is the DSM-5 diagnostic criteria for hoarding. And as you can see here, the first thing is about persistent difficulty discarding or parting with possessions regardless of their quote-unquote actual value. And of course, the actual value means the actual value perceived by regular people, quote-unquote regular people. And the difficulties is due to the perceived need to save item and distress associated with them, with discarding them. And so this means that if somebody has a brain injury or somebody has depression, therefore they lack of motivation or they lack of the brain functioning to sort through things, to discard things, then we don't diagnose them with hoarding disorder. And then the criterion C, the difficulty has to be so strong that it accumulates, the things pile up and cause clutter in the home. The difficulty, just like any other psychiatric diagnosis, we want to see that it's very significantly distressed, and it's not because of other physiological or mental health challenges. So two things that I would like to point out and also specified in DSM-5 is that excessive acquisition, although it's very common among people with hoarding disorder, it's not one of the diagnostic criteria. And clinically, what I have seen is that because nowadays people who seek treatment for hoarding tend to be older, maybe the average age is in their 50s, and I really hope this will change. But right now, what we see, the average age of people seeking treatment is around age 50. And in my clinical experience, is that usually at that point, people already have gone through the phase that they don't have excessive acquisition problem anymore. And now the problem they are facing is more about what do they do with the things that they already accumulate? How do they let go of them? Although some still present this challenge. And level of insight is also a very interesting thing that I would like to mention. So when we go through some diagnostic tools with people in the interview, and sometimes they will say, well, no, I don't think I have difficulties letting go of stuff. As soon as I make up my mind, I have no problem getting rid of them. And it's as soon as I make up my mind. And we'll talk about that more later. So making this decision-making is a main challenge for people with hoarding issues. And the fear of making the wrong decisions, fear of regret, or fear of something that they cannot even describe is the behind the difficulties of making that call to get rid of things. So there are a lot of psychiatric disorder that sometimes co-occur with hoarding disorder. And one of the most common is major depressive disorder. And so this is a very kind of like a tricky situation because, like I said, we don't diagnose people with hoarding disorder if their difficulties letting go of things is because of lack of motivation, because of depression. But sometimes they can coexist. And just because the hoarding makes the person find letting go of stuff hard, it makes it even harder for them to have the motivation to want to face it and want to declutter. Yeah, so this is an interesting area to pay attention to. And the other thing that I also want to point out is that sometimes, even among clinicians, we still think that hoarding and OCD are very much correlated. However, you can see here, it's not as related as depression, actually. And the pathological mechanisms between OCD and hoarding have been found again and again very distinct, and that's why in DSM-5 we make hoarding disorder its own diagnosis rather than part of OCD. So another interesting quote-unquote differentiation diagnosis that people often ask is, how do you know whether somebody is just messy, or they are a collector, or they have hoarding disorder? So I've spent a little bit of time to tell you what I see as a difference. So this picture is actually a picture of my office mate's desk. So he does not have hoarding disorder. I've been to his house, and so you can see there are some like stuff piled up on the desk, but he has no problem finding things or using the desk to do his work. And most importantly, he has no problem getting rid of stuff. There's no emotional distress related to discarding. And his daily activities was not affected. So this is more about clutter rather than collecting or hoarding. And next, I think this is a good picture about collecting. So for people who collect things, usually it's a few specific kinds of items. Like with this, these are dolls they collect, and there are people who collect Disney-related things. And so when they acquire new possession, they usually have a place to go back to go to the collection. And these people often have a lot of pride and a lot of confidence in showing people about their stuff. And there's no difficulties letting go of something if they don't serve the collection purpose. And this is a picture of a hoarded house, and as you can see that it's less organized, and the extent is much greater than simply clutter. And the person has to experience emotional difficulties letting go of stuff. So now I'm going to talk about the prevalence and the impact. So before I talk about that, I want you to check in with the mental image. If you still remember in the beginning, if there was a person in that mental image that you formed, how old was that person in your mind? And so the reason why I ask you is that maybe this is to some of your surprise. Actually, hoarding for a lot of people starts in childhood. So when we did the research here at UCSF, we asked our 300-something participants, who mostly are in their 50s, 60s, or even 70s. And we asked them, when do you recall the first memory of hoarding behaviors? And as you can see, as you can see that, maybe you cannot see, but I'll tell you. So these two bars, this is a bar that's below 12 years old, and this is a bar that's between 12 and 18. So actually half of the participants reported that they started to show hoarding behaviors before they were adults. And so it's a chronic condition, slow and steadily go up. And when kids are still living with their parents, if their parents do not also share the similar kind of struggle, usually things are more under controlled by their parents. And sometimes we hear people saying that it's when I move out and live by myself and things start to get a little bit out of control. And when I have my earning ability, when I start to make money, it gets even more out of control. And often we hear that there is a surge of severity following a loss or trauma of some sort. So as I said before, treatment-seeking average age nowadays is about 50. And I really, really hope that with all of us effort, this number will drop, especially if you work with kids. Screening kids for hoarding disorder in your clinical setting is very important. And the point prevalence rate among the adult community sample, the hoarding disorder prevalence is between 2 to 5%. And you can see in this chart here, so here is the age, here is the prevalence rate. So as people age, the percentage of prevalence increase. And for people who are 70 years or older, the prevalence rate of hoarding disorder is 6%. And the cost of hoarding, as we know, is very, very big. So it directly contributes to almost a quarter of death by house fire. And in San Francisco alone, over 6 million per year is spent on hoarding-related issues. And that was on the societal level. And now if we look at the familial level, and if you imagine if the adult who hoard has a child, and how is the child going to have a proper living space to grow up? And most importantly, how is the child going to be able to spend quality time with their parents, especially if the two adults at home have conflict all the time about the clutter situation? And there hasn't been much resources or support for children with hoarding issues. And it has been the case that even when we provide a support group for adult children or hoarding parents, there's still the field still see them as the helper to help bring their parents to go to therapy or something like that. But something more directly to the children of hoarding parents is necessary, because imagine a lot of times these adult children, they believe that my parents choose their stuff over me. And imagine how that affects their self-esteem and how that affects their relationship going forward. Yeah, and on an individual level, for people who suffer from hoarding disorder, they face a lot of threat for eviction. And this is the data from also from Dr. Matthews' study. We found that more than half of these adult individuals, they cannot move freely in their home and cannot eat at their table, and not able to prepare food or leave their house quickly and things like that. So these are older adults, and I guess if we imagine in our age, not able to do these things are going to be very hard, letting alone that these are older adults. So the cost of hoarding, again, is super big. And so now I'm going to talk about the contributing factors to hoarding, and I hope that will give us some ideas, some more rich ideas about the person, the human that suffers from hoarding, and to look at their psychology more. Hello. Okay, so one thing that I would like to mention is that there is genetic contribution to hoarding. And these are findings from twin studies. So we've found that genetic factors account for about a third to half of the phenotype differences. But so far we don't know which specific genes they are to contribute to hoarding. And social and environmental factors, such as lack of familial warmth, has been found to be related to hoarding severity. and general life stress, particularly interpersonal stress. And there's been growing amount of research showing how people with hoarding disorder have some challenges in terms of interpersonal relationship and also attachment styles, and how those challenges are related to seeking possessions as a source of comfort or sense of security. So I can share a clinical example of people who have difficulties relate or interact with other people. And it's very common for people with hoarding disorders. They go about they go shopping and then they would acquire stuff, and it's not for them, it's for gifts. So, this can be a perfect gift for whoever that may have a baby soon, and the baby is not even there yet. So they already see, this can be a good idea for gifting something. Or they can accumulate a lot of books, because if I have a lot of books, that means I am a smart person. If I'm a smart person, that means that I am useful. If I'm useful, that means that people may like me. People may want to be my friends. So there are a lot of motivations that's related to interpersonal interactions, or how am I going to be liked. And trauma is another very big environmental factor that contributes to hoarding. So there's so far there's no direct evidence to say trauma, quote unquote, causes hoarding. However, in this study that we did 2 years ago, we found that trauma exposure rate among individuals with hoarding disorder is 99.5%. If we use this definition as trauma, if we use this trauma definition by DSM-5. And so the average number of types of trauma is 7. So this is 7 types of trauma, not 7 incidents. So meaning if one of these types is, say, childhood abuse, you can imagine how many times that is. And this is 7 types of trauma. And trauma is associated with the onset of hoarding for those who started to show hoarding behaviors later in life. So if you remember the chart that I showed you earlier, half of the people identified their first hoarding behaviors before age 18. Another half identify that after age 18. So among the late starters, they often can identify a traumatic incident that kind of like triggered the hoarding behaviors to start from when they did not have anything like that going on. Yeah, and regardless whether it's early or late starters of hoarding, trauma is associated with the hoarding symptom severity. And this is especially so for those earlier starters. And psychological factors, of course, there are a lot of psychological factors. So if you imagine, if you care about yourself so much, if you love yourself, if you have self-compassion, would you watch yourself giving your space to possessions rather than yourself? And so I guess it's not too hard to imagine that there are some stuff going on in terms of self-perceptions. And the studies have shown that uncertainty about self-worth is significantly associated with hoarding disorder. And shame and self-criticism, the more shame you have, the more severely symptomatically that you have about hoarding. And emotion regulation and related challenges. For example, people have a hard time tolerating distress, and they have anxiety sensitivity and intolerance of uncertainty. So this is very emotion regulation related challenges, very much highly associated with avoidance, which is one of the main symptoms, if you will, of hoarding disorder. So clinically, we can see a lot of people who would rather be going out than staying at home. So it's not a matter of being busy. It's a matter of staying at home makes me feel uncomfortable because I will have to face the clutter at home and I have to face myself, which triggers me. So they go out, they do a lot of activity shopping. They accumulate a lot of activities on their calendars to avoid, and underneath that is emotion regulation challenges. And based on the CBT model, there's also a lot of hoarding promoting beliefs. And for example, I would like to point out this responsibility for possessions. A lot of the people that I've worked with, they feel very responsible for their stuff. And so sometimes even after they have decided and they've finally made up their mind that they are going to discard this item, they care about whether it goes to a good home. And for a lot of them, Goodwill or Salvation Army, they are not good homes because some of the stuff that they decide to let go of, Goodwill or Salvation Army might not want it, might not even want to sell it. Or even if they do, they want to make sure, this is like say a baby clothes from their own child when they were infants. They want to give it to somebody they know, they can see, they know which person it is. And so if it's a sense of responsibility, almost like this item has a life, that they want to be responsible for them. And perfectionism and fear of making the wrong decision is also a very big thing about that challenge people with hoarding disorder. And a lot of times they believe that if I can have enough time to declutter my house all at once, then I shouldn't even start doing it. Because facing not doing it right is a huge sense of failure that's really intolerable for these individuals. And so many studies have been looking at whether there are any cognitive functioning problems with people with hoarding disorders. And one thing that's not on this slide that I would like to mention is that for a lot of individuals with hoarding issues, they worried about not remembering. They worry about, they often say that I need to lay these papers on top of my table because if I don't do that, I will forget. I have to keep it inside so that I can be reminded. And because my memory is so bad, I have to do that. And interestingly, we hear that so common. Very commonly, but when we pull them into research and give them the standardized memory test, their memory has no problem. Yeah, so it's still a very very interesting phenomenon. Maybe there's some things that we aren't testing right about their memory that's having a problem that we haven't found yet. Or it's that their perception of their memory is worse than their actual memory performance. And the things that the research has shown that there's difficulty, including executive functioning and working memory. And some of these folks have ADHD symptoms, or some actually have coexisting adult ADHD. And visual information processing is also one area that's been found having some difference between hoarding individuals and people without this problem. So I hope that by talking about the difficulties, the psychological contributing factors, environmental factors, that in your mental image, that person become fuller. And that person step forward from the background, because a lot of times, a lot of times when we think about hoarding, we think about the stuff, we think about these things. We're not looking at this person, and that's true even among clinicians, even among people with hoarding disorder themselves. They look at the stuff, and they are not remembering it's the suffering person that requires attention. Oops. So how can we help? The first thing that I would like to mention here is, if you can, please add a few questions to your intake process. And so these are some example questions. It only takes 3 questions. Do you have trouble getting rid of things that most other people might get rid of? Do you have clutter that makes it difficult to use rooms and services in your home? Do you buy items or acquire free things that you don't need or have space for? So these are good screening questions to add. And because sometimes when I talk to clinicians, they tell me, oh no, I don't think we have people who have hoarding disorder in our clinic. But if the prevalence rate is so high, how are you so confident that there is none? And if hoarding is so commonly coexisting with depression, maybe the people who come to see you for depression, some of them have hoarding disorder. And they are not telling you because they don't want to be judged, or they are not aware that that's a problem. And so by adding these questions, it kind of opens the door for people to start have this conversation with you if they are ready. And so one example I would like to share is that the Trauma Recovery Center, which is part of UCSF, they've started to add 3 questions in their intake to screen for hoarding. And they found that there are 13 to 15% of people who come to seek treatment for PTSD endorse these hoarding related questions. So it's very likely that some of the people that you are already seeing may have hoarding challenges, and they are waiting for some of you to open the door. Let's talk about your difficulties letting go of stuff. And there are